Welcome back everyone. Today I'm going to show you some exercises to alleviate some sciatic pain that could be caused by the piriformis muscle, also known as fake sciatica or piriformis syndrome. When this muscle is weak or not activating well or not strong enough, this muscle can spasm and get tight and squeeze on the sciatic nerve that could be possibly running behind the piriformis muscle or even into the piriformis muscle and down from the hip into the back of the thigh, into the back of the knee, and refer pain from the hip and down this area. The piriformis muscle is attached from the sacrum, also known as the tailbone, and then inserts into the femur bone, which is the main long bone in your thigh. Its main action is to externally rotate your hip and externally rotate your leg. So if this muscle is not activating right or it's not strong enough, it may spasm and squeeze on the sciatic nerve and cause referral pain that creates sciatic-like symptoms. I hope these exercises help you as much as they help me and my patients.
Clamshells. Lay on your side with your feet and your hips stacked. Your knees bent 90 degrees and your head is resting on your arm, or you can prop yourself up on your elbow. Draw your knees towards your body until your feet are in line with your bum. Keeping your abs engaged and your feet together, raise your top knee away from your bottom knee as far as you can and squeeze your bum muscles all the way, especially at the end of the movement. This way it will make your legs look like you're a large clam, opening and closing. Hold for about half a second, squeezing your glutes at the top of the movement before lowering your knee back down into starting position. If this is the first time you're doing this exercise, I recommend to start with 10 repetitions first, and once you've built up the strength, slowly work up to about 20 repetitions. Make sure you repeat the exercise on both sides 3 to 4 sets. Clamshells with a band. If these exercises are too easy, you can always add more resistance to the exercise with a resistance band. I'll put a link in the description box below on where to get them. When you do these exercises, you'll feel a bit of a muscular soreness or a bit of a burn in the hip or in the piriformis muscle. Side raises. Lay on your side and with your legs bent back at 90 degrees and with one leg on top of the other, prop yourself up on your forearm to support yourself. Now, whilst keeping the side of your shin on the bottom leg on the floor, raise your hips off the ground whilst raising the other leg that's on top away from the lower leg. Then, in a controlled manner, return to the original position and repeat the repetition again. Do this for 10 to 20 repetitions on each leg, 3 to 4 sets. If you're just doing the exercise with your body weight and it's too easy for you, you can always increase the intensity with an exercise band. I didn't bother using the exercise band in this video because it's already too hard for me. I guess I have to do a little bit more work with this exercise. With all the exercises in this video, we are trying to strengthen the hip adductors with the assistance of hip extension. This will help aid better synergy of assisting muscles such as the glute medius, the glute maximus, the glute minimus with the piriformis muscle. If the other muscles do not help during these movements in everyday life and the piriformis muscle has to do all the work, then the piriformis muscle can spasm, fatigue, and tighten and even possibly cause pain due to overuse and overcompensation. Make sure you do the piriformis stretch video that I uploaded on this channel. It will help loosen and relax the muscles after this exercise video. Standing hip abductions. Stand next to a wall or something you can lean up against, such as a chair, to help you keep balance. Now raise one leg up and lift it out away from your body. Do this in a slow and controlled manner to make sure you activate and work on all the necessary muscles in the hip. By keeping your hand on your hip, it will allow you to know whether you are overextending or even overflexing the hip, causing your hip to pike. If your hip overextends or overflex, it will overactivate the piriformis muscle during the exercise, instead of utilizing the other muscles that we are trying to strengthen, such as the glute muscles. So try to keep the hip in a neutral position as much as possible and not move the leg either in front or behind you. You can do this by slightly extending your hip so that your knee doesn't move in front of you and you're utilizing the glute muscles for abduction and not the piriformis muscle. Do this for 10 to 20 repetitions and repeat it on both sides 3 to 4 sets. If you find this exercise too easy, you can always do the exercise with a resistance band. Try to use a light band first and then work yourself up to a stronger gauge band with greater resistance. Because if you use a very heavy load or greater resistance band, what's going to happen is you're going to rush the exercise and you're going to overactivate the piriformis muscle instead of the glute muscles. A research paper was published in 2010 on piriformis syndrome treatment via hip muscle strengthening on a patient. At the end of the muscle strengthening program, the patient reported back with 0 out of 10 pain with all activities, with all movements improved and increased range of motions. This is why I highly recommend doing strengthening exercises to help you improve functionality and reduce your pain that you could be going through. Hip thrusts. Lay down with your shoulders on the floor and your feet flat on the floor with your hands by your side. Engage your core and thrust your hips up in a controlled manner by pushing your heels into the floor. Try to keep your chin in a neutral position. If you're unsure, just give yourself a slight double chin. This will help you disengage the muscles you don't need to use for this exercise, for example, the overuse of your neck muscles and the frontal abdominal muscles, which pulls your head off the floor because you're doing a crunch. At the top of the movement, I want you to squeeze your glutes and then slowly lower your butt back down to the floor in a nice and controlled manner. Do this for about 10 to 20 repetitions, 3 to 4 sets. This exercise can be made harder with a resistance band to activate the hip muscles much more. However, please do not over abduct the hip on each repetition. In other words, don't push your thighs away from each other just because you have a resistance band, because this will work more on the piriformis muscles and much less on the other muscles that are important to improve hip function. When you have the resistance band around your legs, it's going to try to pull your knees back in. So what you're going to do is you want to hold it in a static hold with the resistance band and fight the resistance band's pull and keep the tension in place whilst you're doing the hip thrusts. There shouldn't be any movement where you're pulling your hips apart as you're hip thrusting, because that will overactivate the piriformis muscle. And we don't want to do that because this is more of a glute activation exercise.
Once again guys, thanks for watching. I really want you to join my VIP Facebook group. I want to build a community there where you can ask questions and I'll do my best to answer them as soon as possible. There'll be other health professionals in that group as well to help you out. Now, if you do have sciatica or sciatic symptoms, I highly recommend you check out my sciatica stretch video. This video will teach you how to floss the sciatic nerve and alleviate a lot of the pain from sciatica. Now, if you do have a lot of pain from sitting down for long periods of time, check out my fixed your sitting down pain video. That video will definitely help you out if you sit for long periods at a time. Now remember, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.